Hello everyone, so today I'd just like to quickly talk about three types of fractures. That is the transverse fracture, the oblique fracture, and the spiral fracture. So before I tell you what each of these fracture means, you can pause this video and have a think about what is the difference between a transverse fracture and an oblique fracture. Okay, so a transverse fracture is where the fracture starts in one side of the cortex. So let's imagine a long bone, right? A long bone. So one side of the cortex, and then it starts at one side of the cortex and ends at the same side of the cortex. Same level on the other side of the cortex. Starts at one side of the cortex, ends at the same level on the other side of the cortex, which means the fracture is exactly perpendicular to the axis of the long bone. So that's a transverse fracture. And an oblique fracture is whenever there's an angulation in that fracture. So it starts at one side of the cortex and ends at a different level on the other side of the cortex. So that's an oblique fracture. Then you might ask, is there a threshold angle to differentiate between a transverse fracture and an oblique fracture? So have a think about that. The answer is that there is no threshold angle. Whenever there's an angle, then it's known as an oblique fracture. So transverse fracture is exactly perpendicular to the bone, and an oblique fracture can be a short oblique fracture, where the angulation is just slight, still an oblique fracture, or a long oblique fracture, where the angulation is further. So, yeah, that's that. And then there's also the spiral fracture. So, what's the difference between a spiral fracture and an oblique fracture? In a 2D image, you might be able to see that you might see that actually oblique fracture, spiral fracture, they look just about the same, but however, it's slightly different when you look at the real X-ray. So for a oblique fracture, it's just one line from one side of the cortex to the other side of the cortex on a different level. However, for a spiral fracture, which is usually caused by a rotational injury along the axis of your bone, the fracture starts at one side of the cortex, goes to the other side of the cortex, and then sort of comes back to the same side of cortex. And depending on the extent of the spiral fracture, it can go back to the other cortex again as well. So that's a spiral fracture. So we will be looking at a few, search Google for some images to try and differentiate between an oblique fracture and a spiral fracture. So here, change view. Okay, so let's look at X-ray. So you can see this is an oblique fracture. It goes from one side to the other side. There's a transverse fracture here. This is an oblique fracture. And then let's look for spiral fracture. X-ray. So let's see a spiral fracture as sort of like a rotational kind of, you see it goes from one side to the other side and then it goes to the other side. Although this is displaced, so can't really see, but you can see that it starts somewhere here. It goes to this side of the cortex, it goes to the other side of the cortex, and then comes back to this side of the cortex again. How about this one? This one, yeah, you can see the line here. It starts from here, goes to this side of the cortex, and you see there's some lines here which goes back to the other side of the cortex. So there's a spiral fracture. How about this one? This one can't really see properly. Here. It starts here, goes here, and then there's a line here, I guess. And it's going back to the other side. What about this? Yeah, okay, I guess that's enough examples. This is a spiral fracture. Yeah, so it goes from this side, goes to the other side, and comes back to the same side. Actually, this might be a combinated fracture. Looks like more than 3 fragments. I don't know. So that's a spiral fracture. And then if you see oblique fracture, let's look at this one. Yeah, it's just one side to the other side. It doesn't come back. It's one side to the other side. That's oblique fracture. It's one side to the other side. Oblique fracture. This looks like a transverse fracture. Yep. Okay, so that's the difference between spiral, oblique, and transverse fracture. Let's look for a diagram. Types of fracture. I can see each of this side by side. Maybe something here. So it looks better. Transverse fracture, linear or longitudinal fracture is oblique fracture, oblique displaced. Spiral fracture, this is 2D image, so you can't see the fracture extending back to the same cortex. Green stick fracture is only fracture on one side of the cortex, and combinated fracture, more than 2 pieces of bone, so 3 or more fragments of bone. So combinated fracture. So we are talking about transverse fracture, oblique fracture, and spiral fracture. So this one, and this one are differentiating. So among these 3 fractures, have a think about which of these fractures is the most stable. Pause the video, think about it, and come back to this video. And the answer is that spiral fracture is the most stable. The reason being, it has the highest area. It has the biggest area of raw area of the bone, so callus formation is easier, and then there's a increased surface area for contact between the raw areas. So, and transverse fracture, when you just angulate the bone a little bit, the cortex will be separated. The other side of the cortex will be separated. Whereas for oblique and spiral fractures, relatively, if you angulate a little bit, there's still quite a big surface area for the bones to heal. Yeah, to form callus and heal. So oblique fracture compared to spiral fracture, because it has go one cortex to the other side of the cortex and back to the same side of the cortex and all. It has a larger raw area compared to oblique fracture. So transverse fracture is the least stable, oblique fracture is in between, and then spiral fracture is the most stable. And then the other question is which fracture is caused by requires the least energy trauma to occur. Is it transverse, oblique, or spiral? Have a think about it and then come back to the video. And the answer is spiral fracture. Spiral fracture requires the least energy to occur. And you can think about it in the sense that in your bones, your formation of your bone, you're accustomed to lateral force. However you use the bone will be stronger in that way. So if you use when you stand up, your bone will be strong in the vertical axis. So compression fracture is like quite difficult to happen. And then the lateral force is there as well. However, you don't usually have rotational force on your bones, so your bones are weakest in that direction because they face that kind of force the least. So spiral fractures can easily happen, especially when, for example, when people are arm wrestling. A common injury is spiral fracture of your humerus because arm wrestling causes rotational force on your humerus, so it can cause spiral fractures there. Yeah, I think that's all I want to talk about. All this information's from lectures, and please go and confirm. It's not 100%, might not be 100% correct. Just do your own research, and I hope it helps in your studies. That's all I want to talk about. See you in the next video.